to the I-29 Moo University Dairy webinar for today. It's strategies for selective dry-off treatments. Today we welcome Dr. Royster as she will discuss algorithm-guided and culture-guided selective dry cow treatments. And when to consider them and when not to. Dr. Royster is an assistant professor in dairy production medicine at the University of Minnesota College of Veterinary Medicine and faculty advisor for the University of Minnesota Laboratory for Udder Health. Dr. Royster is involved with research, teaching, and outreach related to mastitis control and diagnosis. Particularly, she enjoys on-farm diagnosis. At this point, turning the mic over to you, Dr. Royster, the podium is yours.
Great, thank you so much. And thanks for inviting me to do this webinar. So as Fred said, I'm a veterinary professor at the University of Minnesota College of Vet Medicine, and I'm the faculty advisor for the lab for Udder Health, which means I do a lot of the client communication around mastitis detection and diagnostics that we offer in the lab for Udder Health. And I work with clients on troubleshooting and test selection and things like that. And the reason I'm here today is that I was part of our research team along with several other professors and graduate students, both at the University of Minnesota, in Iowa, and Cornell, and in California, all across the US that worked on some of these selective dry cow therapy research trials. So I'm just going to jump right in. Please, if you have questions, I would say put them in the chat, and I'll ask Fred and Jim to kind of help monitor the chat for me. And if there's a good point to interrupt me to take questions, we should have plenty of time for questions. Just getting my, there we go. So jumping right in, selective dry cow therapy, let's just define what we're talking about. When we say selective dry cow therapy, what we mean is we are reserving antibiotic dry cow therapy for cows or quarters of cows that we either know or strongly suspect of being infected at dry off, as opposed to our sort of traditional or historical practice of blanket dry cow therapy, where every quarter of every cow is treated with antibiotics at dry off. So in this new paradigm with selective dry cow therapy, cows or quarters that are unlikely to be infected don't get antibiotics. So that's what we're talking about. But why are we talking about it right now? There's a bunch of different reasons. One is that the dairy industry is under some pressure to demonstrate that we are practicing good antibiotic stewardship. And in doing so, we're reducing the risk of the development of antibiotic resistance, particularly in medically important antimicrobials. And we know from a bunch of different research trials at this point that by practicing selective dry cow therapy, we can reduce antibiotic use at dry off by 20 to 47% at the cow level, or if we practice it at the quarter level, up to 70 to 80%. So here's what that means. That means that 70+% of quarters are not actually infected at dry off. And this is one of the major reasons why we're talking about this right now. When blanket dry cow therapy was a common recommendation, the prevalence of infection at dry off was much higher. So it made a lot more sense to go ahead and just treat everybody at the time of dry off. We had a lot more higher prevalence of contagious pathogens at that time as well that really benefited from antibiotic dry cow therapy. That's not really the case anymore. A lot of farms have very good mastitis control, zero or very little contagious pathogens, and very few quarters that are actually infected at dry off. And again, we know from all of these research studies that we can practice selective dry cow therapy effectively without having any negative impact on udder health or performance in the next lactation. And that's a really important point, because I think a lot of producers have some trepidation about implementing selective dry cow therapy, partly because we've been so good at pushing the recommendation of blanket dry cow therapy as a really effective preventive measure, that people have some trepidation about moving away from that. They want to make sure that they're doing the best that they can. They want to make sure that they're clearing up any infections and setting those cows up for success in the next lactation. But really, if 10 to 20% of quarters are infected at dry off, and we can accurately assess which quarters or cows do need antibiotic treatments, we can practice selective dry cow therapy without having an increase in clinical mastitis or somatic cell count, or a decrease in production, or an increase in culling or death in the next lactation. And again, we know this from multiple studies now all over the world, but particularly in North America, where we know what our management practices are. We know that we can implement this successfully with no negative consequences. Another important point about why we should be really seriously considering this is that we have multiple approaches that can work. So every dairy can figure out what works best for their herd. We have both culture guided and multiple different approaches to an algorithm guided selective dry cow therapy program. And I'll talk a little bit more about what that means. And then lastly, we know that it's profitable for most dairies, which intuitively probably makes sense to you. If we aren't going to treat, if we're going to reduce our antibiotic usage by 70 to 80% or even 50%, it's going to be a positive economic benefit to switch to a selective dry cow therapy program. And again, I have more data on this for you later in this presentation. So just to give you a little snapshot, there's a ton of research now that has been completed in North American herds, both in Canada and in the US, looking at various different approaches to selective dry cow therapy, both at the cow level, where we say this cow is likely to be infected, I'm going to treat her, this cow's not, I'm not going to treat her with antibiotics, or quarter level, where we're going to say this individual quarter might be infected, I'm going to go ahead and give her this quarter antibiotics, but I might not treat the other 3 quarters that are not likely to be infected. And again, these studies have looked at a variety of outcomes, both sort of dry period intramammary infections, so new infections over the dry period, cure over the dry period, the prevalence of infection at calving, and then performance in the next lactation, including clinical mastitis, culling, death, milk production, and somatic cell count. And all of these studies listed here concluded that if practiced appropriately, selective dry cow therapy has no negative effects on any of these outcomes. So let's talk a little bit about this cost savings. Our Sam Rowe, who was our former PhD student here at the University of Minnesota, did a modeling study looking at the likely cost benefit of practicing selective dry cow therapy, and found that it's likely to be cost effective in the average herd. An algorithm guided approach, where we're using data that we already have on the farm to decide which cows to give antibiotics to at dry off, is likely to be more cost effective than a culture guided, where we're implementing new culture procedures to say, is there bacterial growth from each quarter from this cow, to decide which cows get antibiotic dry cow therapy. In the average savings, again, there's going to be herd to herd variation, but the average savings in this study was $7.85 per cow dried off for an algorithm guided approach, or $2.85 per cow dried off for a culture guided approach. The savings could be more than that, particularly in herds that are using a relatively expensive dry cow therapy product. So you're going to save more from using less of it. Herds that can substantially reduce antibiotic use with selective dry cow therapy. So again, that's going to be herds that have a pretty low number of infected cows or quarters at dry off. And then importantly, herds that can actually do this without causing any Udder Health problems, because selective dry cow therapy is not like a slam dunk, everybody can do it right now with 0 problems. There's an appropriate way to go about it. And if we don't sort of check all the boxes, we could result in worse Udder health outcomes. So we want to make sure that we don't go down that route, because that's probably not going to be financially advantageous. If you want to look at the cost benefit for your particular herd, you can use this cost calculator that Dr. Rowe designed, and the link is here. And then I put a link to a nice overview of the study if you want to read more about kind of how they come up with the numbers here. But this is just a snapshot of what this cost calculator looks like. So on the left panel, you put in the specifics for your herd, how many cows dried off in a year, whether or not you are already on DHIA tests, the cost of tubes that you're using, an internal Teat sealant, and a few other variables. And then the calculator tells you what the benefit is going to be for switching to a selective dry cow therapy program, and the different option for algorithm versus culture guided. So let's talk a little bit about if you haven't already implemented selective dry cow therapy, if you're thinking about it, what do we need to do to make sure you're ready to do this successfully? Big picture, I think all the experts kind of agree that selective dry cow therapy is not something that just every single herd in the US should go out and do right now. There are some herd level criteria that are important for deciding whether or not you're ready to successfully implement selective dry cow therapy. The first one is that you generally have a pretty healthy herd, particularly from a mastitis perspective. If you have a pretty low prevalence of infection at dry off, represented by a bulk tank somatic cell count less than 250,000 cells per mil, that's one important criteria. So if you have a low bulk tank somatic cell count, that generally means your risk for having a high proportion of infected cows at dry off is lower. The next important criteria is you have good control of contagious pathogens. If you've got Mycoplasma, Staph aureus, maybe Prototheca, and God forbid, Strep agalactia, if those pathogens are a problem in your herd, we probably want to get a good control program going and get those kind of taken care of before we start selective dry cow therapy. Another important factor is that we need to be able to use an internal teat sealant, ideally, properly at the time of dry off. Antibiotic dry cow therapy is very effective at treating existing infections that are present at the time of dry off and preventing any new infections that occur early in the dry period. So if we're not using antibiotics because we don't think that cow or that quarter is infected, we still want some way to protect that cow from getting new infections over the dry period. And this is where teat sealants come in. Again, we know from a just ton of research that internal teat sealants, when used correctly, are very, very effective. And part of the reason why we've had such success in our selective dry cow therapy studies is that we used internal teat sealants to protect against new infections. And we can compare that to selective dry cow therapy research that happened 20 and 30 years ago now, that those studies were not as successful because they really didn't have an effective way to prevent new infections over the dry period. So we need to be able to use a teat sealant effectively. Another important criteria is that we need to have personnel on the dairy that are adequately trained to perform cow selection and dry off procedures cleanly and appropriately. So they understand the program and they can perform the actual logistical procedures correctly and cleanly. And then lastly, it's important that we have a good ability to monitor outcomes of the program, because again, if we don't do a good job with some of these other things, if we have contagious pathogens, if our dry off procedures aren't perfect, we could be introducing infection at the time of dry off or having more new infection over the dry period. And we want to be able to monitor that so that we can troubleshoot before things get out of hand. So we need to be able to monitor outcomes. So let me talk a little bit more about some of these criteria. First, if our goal is to say, let's say we're a herd and we've got a bulk tank somatic cell count that's in the upper 200s or low 300s, for example, and we're thinking about selective dry cow therapy, what do we need to do to get our bulk tank somatic cell count back under 250 so that we can start thinking about this? I would say, generally speaking, I mean, every herd is different, but the environment on most well-managed dairies is the #1 risk factor for mastitis. That's where your exposure to your environmental pathogens comes from. So having really good bedding management, making sure that the cows are clean and dry, and particularly looking at the dry cow pen where dry cows are housed to make sure that that's not a particular risk factor for these high-risk cows is important. So troubleshooting our sort of environmental exposure risks would be probably the first place to start on most dairies. And then the second place is looking at our chronic cows. A lot of dairies, even dairies that have no contagious mastitis, have a population of cows that are chronically infected with what are typically thought of as environmental pathogens like strep uberis or Klebsiella that are going to carry those infections throughout the dry period. And we want to make sure that we're identifying these cows and eliminating those infections when we're beyond the point of treating them effectively. Cows that have chronic mastitis are very unlikely to respond to any sort of therapy. And that's probably a significant source of an elevated bulk tank somatic cell count on a lot of dairies is this population of chronically infected cows. So identifying those, making some decisions about culling, or potentially making some 3/4 cows if we've got some chronically infected quarters is a way to reduce the risk of those cows, spreading it around the herd. And then the other, common troubleshooting areas, we think about the mastitis triangle, right, is what's happening in the milking parlor and with our milking equipment. So minimizing the risk of new infections in the milking parlor would be probably my number 3 for where I'm going to go to troubleshoot to try to get my bulk tank somatic cell count down and my risk of infection down before I think about selective dry cow therapy. So let's talk a little bit about contagious mastitis control. So the 3 big points about contagious mastitis control are going to be herd security, a good screening test strategy, and taking common actions to reduce the risk of transmission within the herd. So again, contagious mastitis, I'm talking about Mycoplasma, Staph aureus, Strep agalactia, and Prototheca. So herd biosecurity just means that we are being prudent so that we don't introduce these pathogens into the herd through our replacements. So if we're purchasing cattle, we are getting a bulk tank culture from the source herd if possible. If not possible, we are testing those animals upon entry to the herd to make sure they don't have any of these pathogens, or at minimum, we're doing bulk tank screening in our own herd to identify contagious pathogens early before they become a problem. So testing strategy, let's talk a little bit more about testing strategy. I want to make the point that if you are not doing bulk milk screening on a regular basis in your herd, you should start doing it right now. I strongly believe that every herd would benefit from ideally monthly, but at minimum, quarterly bulk tank cultures to screen for contagious pathogens. It's a relatively low cost insurance strategy to make sure that you don't have those in your herd. Or to find them relatively quickly if they do get introduced to your herd. Biosecurity is important, but it's not the only way that these pathogens gain entry in your herd. Staph aureus is a common skin commensal, so it is present in your herd even if you don't have any Staph aureus mastitis. You can develop Staph aureus mastitis tomorrow. Similarly, Mycoplasma is a common respiratory pathogen in calves, you probably know. So again, just because you don't have Mycoplasma mastitis today doesn't mean that you're not going to calve in a heifer that's a persistent carrier from calfhood who's going to start shedding Mycoplasma when she freshens for the first time. So regular bulk milk screening is a great, relatively cheap way to detect this early before it becomes a problem. A second important method for kind of screening and making sure that your risk is low is regular diagnosis of clinical mastitis. This is a key point that pretty much everyone agrees is an important step to take before and during selective dry cow therapy implementation, is that we know what's causing mastitis on the dairy. We have a good understanding of sort of the pathogen ecology on each specific dairy. And again, there's 2 benefits here. One is that can help us make good treatment and management decisions when we know what's causing mastitis. It helps us know where to go to prevent those exposures, and how to treat it most effectively. And also, again, it allows us to screen for contagious pathogens in the cows who are most likely to be infected with those pathogens. So it's a good step to take to protect your herd, to identify problems early, and just to be able to make good management decisions about mastitis on your dairy. And then a third strategy is screening fresh cows. So screening fresh cows is nice because it's kind of a balance of testing everybody in your herd on about a yearly basis and having a pretty convenient way to sample them, because we're already processing them at freshening. We can take a pretty easy sample at that time, put them in the freezer, submit them, at the end of every week or at the end of every couple weeks, and screen those samples for contagious pathogens. So every herd will kind of pick a different strategy. Herds that are relatively low risk for contagious pathogen, have a very low bulk tank somatic cell count, might just do bulk milk screening, right? Herds that maybe have some higher risk factors would, I would say, incorporate a few different strategies like bulk milk screening plus diagnosis of clinical mastitis, or bulk milk screening plus fresh cow screening, as a way to kind of just monitor for contagious pathogens and the level of contagious pathogens as you're implementing control practices. So the third, you remember we talked about, so for control of contagious pathogens, good biosecurity, a screening strategy, and reducing the risk of transmission. I already told you that, some of our contagious pathogens can pop up into your herd, even if you're a closed herd and you've never had those problems before, you could have them tomorrow. So having steps in place that help reduce the risk of transmission in the herd can sort of minimize the impact when those pathogens do pop up. So we're talking about excellent milking time hygiene, proper maintenance of equipment function, proper milking equipment function and maintenance, good fly control, because we know particularly that Staph aureus can be transmitted by biting flies, teat skin condition care and monitoring, again, identifying and eliminating contagious and chronic infections, and then just having good, strong, low stress, healthy cows will do a lot to minimize the risk of transmission on the dairy. So moving to our next kind of key point about how to successfully implement selective dry cow therapy and get ready for selective dry cow therapy. We need to be committed to excellence at the time of dry off. From talking to some other advisors across the country who have helped dairies implement selective dry cow therapy, the ones that have gone wrong are the ones that didn't do this part well. You can get all the other things in place, and then if something goes wrong at the time of dry off, that's when we start to see problems where we're introducing new infections because we didn't have good, clean infusion techniques, or we didn't get the Teat sealant administered correctly, and so it wasn't able to protect those quarters against new infection. So the time of dry off is an important time to sort of evaluate, make sure that everything is going really well, and not just once, but consistently monitoring that dry off is going as well as you think it is. So we kind of talk about two different things, both our dry off strategy, which is kind of when and how we dry off cows, and then the dry off procedures, which is all the intramammary treatments that we do. So Jim and I have talked about this a couple times. So one of the biggest questions or most frequent questions I've gotten about selective dry cow therapy is, what do I do with my high producing cows at dry off? We know that high milk yield at dry off is a risk factor for new infections in the early dry period, probably for a couple different reasons. One, there's increased pressure in the mammary gland, which probably, is a risk for milk leakage. So that teat sphincter at the end of the teat is not able to close and form a keratin plug and prevent entry of pathogens up into the udder through the teat. The other important point is that if we have a bunch of milk still in the gland, we're diluting some of the protective factors that naturally exist during the dry period to help fight off infection. That includes lactoferrin, immunoglobulins, phagocytic cells that are sort of the first responders that destroy pathogens when they gain entry. So if high milk yield is a risk factor, what do we mean by high milk yield? What milk production level is too high at the time of dry off? And if anybody here has a real black and white answer on that, or an opinion about what it is in your herd, I would really like to hear that. There is really not good data to say that X pounds of milk production is too high a risk at the time of dry off, and we shouldn't dry off those cows, or we should do something to decrease their milk production before we dry them off. I did another little literature search this morning and found a few papers that tried to look at this from a couple different angles. And in this one study, they found that 36% of cows who were producing 46 or more pounds of milk at dry off had developed new infections, compared to just 18% of cows who were producing less than 46 pounds of milk. And I would say that that sort of coincides with a lot of the practical recommendations I've heard around this 50-pound benchmark. If cows are being dried off above 50 pounds of milk production, that's probably a significant risk, and we may need to take steps to reduce that risk for those cows. So to that point, what's the best method for drying cows off? We know from a couple different studies that we can reduce milk yield at dry off and therefore reduce the risk of new infection by either intermittent milking for a week or 2 weeks before the time of dry off, compared to just abrupt cessation of lactation, or by decreasing the energy density of the ration in the week or two leading up to dry off. So we know those are effective tools. logistically, they can be difficult to implement on a dairy. So every dairy kind of needs to evaluate whether this is necessary on a programmatic level, or if we just need to take sort of individual cow actions. I know we can talk about this a little bit more when we talk about algorithms, but I know that for some herds, that's a criteria that they look at when deciding whether or not to go with selective dry cow therapy or no antibiotics versus antibiotics. If a cow is milking over 50 pounds, she's automatically going to get antibiotics because we know that there's that risk of her developing a new infection in the early dry period. So again, I've mentioned teat sealants already. Teat sealants we know are very effective at protecting against new infection, but they are a risk if we use them without antibiotics at the same time. So if we have a cow or an individual quarter that we don't think is infected at the time of dry off, we don't need to use antibiotics, but we do still need to use an internal teat sealant. So if we're going to use that internal teat sealant with no antibiotics, we need to be doubly sure that we use super good, clean technique when we're administering that orbicele so that we're not introducing new pathogens into the udder with that orbicele, okay? It's very, very important. And then again, the personnel. So is whoever is in charge of this on the dairy kind of needs to understand what the goals of selective dry cow therapy are. They need to understand the importance of hygiene. They need to have the tools and the training to do everything right. And they need to be accountable for the outcomes, which kind of leads to my next and last point about getting ready for this is monitoring. We'll talk a little bit more about specifically what to monitor later, but having really good, consistent record keeping for clinical mastitis is key. So if you're not, accurately and consistently recording clinical mastitis cases now, start doing that. DHI somatic cell count data is also very helpful for monitoring selective dry cow therapy. And as I've mentioned before, bulk tank somatic cell count and culture is also useful for data for monitoring the success of this program. So we can use those monitors as feedback on our program to decide whether or not it's working, if we need some troubleshooting, particularly at the time of dry off. I was on a, comparing scenarios. I've been on a couple different herds lately. One herd that did dry off, it was, at the very end of the milking shift. So you've got your milkers who've been there for 12 hours. They're probably tired. They're gonna do all the dry off procedures and the milkers were doing it. So this was a relatively large part of this. So there were several milkers who were doing dry offs. Wasn't the cleanest scenario I've ever seen. And I was a little bit worried about some of those risk factors versus another dairy that I was just on recently where same thing, they did the dry off procedures at the end of the milking shift, but it wasn't the milkers who did it. It was the herd manager and a herds person who came in and they had their clipboard, they had good, clean, like new, clean aprons to carry all their supplies in that were not the regular milking aprons that were, kind of dirty. They had their clean clothes on, clean gloves. They came in, it was nice and quiet in the parlor. They could really focus on what they were doing and they had the protocol down. I mean, they were super consistent, very clean. And it's just, that's kind of what you're aiming for at the time of dry off. You want to make sure that you have the right people, the right timing, and your procedures are really good at the time of dry off. So you're ready to go, right? We've addressed the risk of new infection. We have good contagious pathogen control. We know how to effectively use a teat sealant. We've got the right people and procedures in place, and we can monitor outcomes. So your next decision, if you think you're ready and you're not already doing this, is to pick which method of selective dry cow therapy you're going to use on your dairy. So let me go over these. Culture guided selective dry cow therapy is where we're going to collect milk samples about 2 days before dry off. We're going to swab those onto a culture plate, incubate them. If there's any growth on the plate, we're going to treat that cow. That means that ideally, if you collected a good milk sample, if there's growth on the plate, it means that bacteria or microorganism came from inside the cow's udder, and we're going to treat that cow or quarter with an antibiotic dry cow tube plus a teat sealant. If there's no growth, she's just going to get a teat sealant alone. This picture up here in the corner is a picture of our forecast selective dry cow therapy plate. It is a 4-quadrant plate. And the reason there's 4 quadrants, it's not like an on-from culture plate where there's a different media in each quadrant. There's 4 quadrants to correspond to each quarter of the cow to make it easier to say, to do quarter level culture guided selective dry cow therapy. So again, this culture, the benefit of culture is that you're getting an actual diagnosis of intramammary infection at the time of dry off, because we're growing the microorganism on a plate. This is a good choice for farms who are already practicing on-farm culture, or maybe that have a nearby vet clinic lab, for example, that can offer rapid, low-cost culture results. And also, this is going to be a good option for farms that aren't already on DHIA, that don't have monthly somatic cell count data or some other way to practice algorithm guided selective dry cow therapy. So culture guided is going to be the way to go for some farms. Other farms have the option of what we call algorithm guided selective dry cow therapy. And what that means is we're going to use some combination of data that we already have to make a decision about whether or not a cow or quarter is likely to be infected at the time of dry off. Most algorithms are going to use a combination of somatic cell count history and clinical mastitis history to decide whether or not the cow is going to get antibiotics. So a common algorithm that has been studied is the cow gets dry cow antibiotics if she has any test in this current lactation over 200,000 cells per mil, if she's had 2+ cases of clinical mastitis, or any clinical mastitis within the last 14 days of dry off. This is going to be a good approach for farms that are already on DHIA, where culture is not practical on the farm or available locally for a reasonable cost. And we now have some good data support tools in the industry that can help us with this. Minnesota DHIA now offers this modified 370 flex report for eligible herds. So again, we have herd eligibility criteria. So the herd's got to have at least 8 DHI tests in the last 12 months. Their herd somatic cell count less than 250, and not more than 3 tests where the average was over 250. And then the report basically is going to tell us which cows are eligible for selective dry cow therapy or not getting antibiotics based on cow level criteria. So somatic cell count less than 200,000 at the last test, and the average for the last 3 tests not more than 200,000. And this is just an example to show you, the cows to dry off in the next 60 days, and the green shaded ones are the ones that are potential candidates for no dry cow antibiotics. But you'll notice here it says check your records. So the guidance is you get these cows that are potentially eligible, and then you go and you look at the records and you say, yep, she hasn't had more than 1 case of clinical mastitis. She's got a dry period that's less than 99 days. We don't want to practice this in cows that have an extended dry period for some reason. She has no signs of mastitis at the time of dry off and no history of chronic mastitis. If she meets all those criteria, she's going to get an internal Teat alone and no antibiotic dry cow tubes. Dairy Comp from Valley Ag Software now also has selective dry cow therapy decision support tools. So it's under their econ menu, and you would work with Valley Ag and your veterinarian of record to kind of set up parameters. So you get to pick for your dairy, what's right for your dairy, a days carrying calf minimum threshold, a somatic cell count threshold, the number of somatic cell counts tests to consider in the calculation, and the number of mastitis events. So you can set those parameters however you want them for your dairy. And then again, Dairy Comp will tell you, yes, this cow can be considered for internal Teat alone, or no, she needs to get antibiotic dry cow therapy. And then you can also, using the cow care module or protocols, have protocols set up for those decisions. So you can, on your dry off list, it tells you which cows are eligible for what and exactly what the treatment is for those cows. And then in addition to this SDCT econ command, which populates your dry off list, they also have a selective dry cow therapy monitoring tab under guide, which again goes back to all those things that we want to monitor. And if you're interested in this, if you haven't seen it already, if you don't have it on your current Dairy Comp, you might need to just update to get the latest version. And if you want a little bit more information, Craig Walter did a really nice short webinar to kind of explain how all this works in Dairy Comp. So I want to take just a minute to kind of talk about different algorithms, because different algorithms have been used in different research trials. They're used in different parts of the world. For example, there might be algorithms that only look at somatic cell count data. For example, we might say, okay, we're going to practice, we're going to give internal teat sealant only to cows, first lactation cows who had a somatic cell count under 150, and for lactation second and greater cows, somatic cell count under 50,000. Or there might be criteria that use, different somatic cell count or combination somatic cell count and clinical mastitis criteria. So there's a bunch of different ways to do this. So herds have some flexibility to choose an algorithm that makes the most sense for your herd, your risk of mastitis, your availability of dry cow tubes, so how many cows you can actually give antibiotic dry cow therapy to. So knowing that there's all these different algorithms, a question you should be asking is probably, is there a perfect algorithm? There are certainly algorithms that have been tested that we know work pretty well, like the ones I've mentioned, but an important thing to note is that if we compare algorithms to a gold standard diagnosis of infection, so if we say, can this algorithm adequately diagnose a cow or a quarter with mastitis? The comparison to the gold standard of milk culture is not great. They're actually not, they have a pretty poor correlation to gold standard diagnosis of infection by culture. And yet, they still all work pretty well in a selective dry cow therapy program. And there's a couple different reasons for that. One goes back to the point about the very low infection prevalence at dry off on most dairies. If you have only, a small percentage of quarters infected, if your algorithm tells you that the cow is negative or likely doesn't have mastitis, that test is going to have what we call a high negative predictive value, because there are just so few cows that are infected at the time of dry off. If our algorithm tells us the cow's not infected, it's likely to be correct, which is important because we don't want to miss quarters or cows that are truly infected that need antibiotics, right? So high negative predictive value tells us if the cow does not meet the criteria for treatment, there's a good chance she's not infected. That's good. That's good to know, right? Even though these algorithms are not perfect, they're good enough at predicting whether or not a cow needs antibiotic therapy. The other important point is that if we look at their predictive ability for major pathogens, they're much better than if we just look at their predictive ability for all pathogens. So we have some research going on looking at whether or not we need to treat every pathogen. So one step beyond selective dry cow therapy, as I've described it, not just is there infection, yes or no, but is there an infection that we need to treat, yes or no? Because some of these infections don't have a high significance, or maybe they're likely to self-cure over the dry period, and they aren't likely to cause negative consequences if they carry that infection into the next lactation. So for example, maybe some coagulase negative staphs. So even though these algorithms are not perfect, they're good enough in a low prevalence herd, and they're particularly good enough for the pathogens that we most care about treating if they're present at the time of dry off. So again, this, I think, is in part what makes selective dry cow therapy work right now, is that you can choose an algorithm that meets your farm goals. If your goal is to maximize the reduction in antibiotics, then you want an algorithm that has few false positives. We want to treat as few cows as possible. So for example, that might be an algorithm that has a higher somatic cell count threshold over a more limited time frame following or coming up to the dry cow period. If our goal is to minimize the risk of missing infections, we want an algorithm that has relatively few false negatives. So we might use a lower somatic cell count threshold over a longer time frame to make sure that we're getting, all the possible infections that might be there at the time of dry off for antibiotic treatment. So consider what your risk level is, what your risk tolerance level is, and I would say work with a veterinarian to help you select an algorithm that's most appropriate and logistically feasible in your herd. And again, unfortunately, with our challenges with dry cow tube antibiotics, that may go into this decision, right? How much antibiotic dry cow tube can we get? That's going to inform what our criteria might be for picking the cows that need antibiotic treatment. So I want to say just a few words about monitoring, because this is kind of our last most important thing that we want to make sure we're doing as we're implementing selective dry cow therapy. So there's a couple important things or time periods that we want to monitor to make sure that things are going well. The first is the dry period. So the things that we want to monitor for the dry period are going to be clinical mastitis in the early dry period. That would tell us if we're developing new clinical cases, not early the next lactation, but early in the dry period. That tells us that we have a problem with our dry off procedures. So to do this, we need to actually look at our dry cows in our dry pen and look for signs of udder inflammation or illness that would indicate that, we maybe have given these cows a new infection at dry off. The other things that we want to look at are monitoring the infection dynamics over the dry period using the cow's somatic cell count. So new infections, cures, the number of clean cows, the number of chronic cows that made it through the dry period using DHIA somatic cell count data. And then dry period length consistency is also going to be an important monitor to tell us that we're not adding risk level by having highly variable dry period length. The second area that we want to monitor to know that our selective dry cow therapy program is working is the early lactation period. So we wanted to monitor clinical mastitis and early detection. To do this, we need to accurately and consistently detect and record clinical cases. The other thing that we can look at is the somatic cell count in early lactation. That indicates how many cows are subclinically infected. So we would look at the percentage of cows with the first test greater than 200,000 as an indicator of the proportion of cows that are subclinically infected. And we want to monitor these things over time. And then lastly, we want to monitor our herd level risk and contagious pathogens with bulk tank somatic cell, regular bulk tank cultures, and routine culturing of clinical mastitis throughout lactation. And I would say, again, these are 3 areas that we want to start monitoring now and continue monitoring as we implement selective dry cow therapy. So we have a baseline and we know if our selective dry cow therapy, made things better, made things worse, or we're just cruising along with no change, right? So to end with a couple additional resources, the University of Minnesota has some nice extension materials on their website, a nice fact sheet. In addition, Sandra Godden, who was the primary researcher on a lot of these studies, recorded a Moose Room podcast with Dr. Joe Armstrong, and those are going to be good podcasts. I also just listened to this podcast this week with Michael Capel from New York. He's a practicing veterinarian from New York who has helped numerous farms implement selective dry cow therapy. And he has some good tips and tricks for, what to watch out for and the key factors to kind of get ready for selective dry cow therapy as well. So with that, we got plenty of time for questions here. I know that was a lot of kind of general information. So hopefully you have some specific questions that we can get into here.
Thank you, Erin. We'll just ask those listening if they've got a question to unmute and go ahead and ask the question. We've got kind of a small group, so we can kind of work with that. As we go to kind of kick off this, when we were talking about scoring, what's your thoughts on Teat scoring? Is it worthwhile? And when should we do it?
Yeah, that's a great question. So when we're talking about Teat scores, we're usually talking about hyperkeratosis, where we've got some proliferation of skin at the teat end. And we know from some research studies that when we have that hyperkeratosis at the teat end is going to be both more difficult to clean and harbor more bacteria and dirt at the teat end. And it could also interfere with the teat canal's ability to adequately close. So I do think teat condition scoring and teat hyperkeratosis scoring are important, both from a general mastitis perspective and in terms of, again, I think I mentioned skin condition as one of my key points for contagious pathogen control. But it also could have some implication at dry off for the teat end's ability to adequately form a seal at dry off. So I will say I think that it's useful information. I'm also not a fan of spending a lot of time scoring things that don't need to be scored. So I would say, work with your dairy advisors to figure out whether or not this is a risk factor. And if you think it is a risk factor, then do some serious scoring to figure out kind of what your baseline percentages are for the different hyperkeratosis scores, and then implement some changes and rescore to see changes over time. Did that answer your question, Fred?
Yes, it did. Jim, did you had a look like you were just all set to ask a question?
Well, yeah, there is a question in the chat. You can maybe see it, Aaron. Will the presentation slides be shared, or were they just, do you have those up on a website somewhere, Aaron? Or can they just get it through obviously watching I think they're looking at some of your resources, probably some of the links.
Yeah, is there, wherever you're going to post this webinar, I'm happy to send you a PDF and you can post this right along with it.
They'll be
Okay.
posted on our Moo University website, as well as I believe South Dakota and Iowa State will have it posted on their dairy team websites also.
I do have a question, Aaron. You know, I'm working with more herds now where we've got really overall pretty low somatic cell counts, pretty low new infections, but we're getting older herds. And so we've got a fair number of old chronic cows. So a percent of the herd that's chronic is pretty high. So it's dragging the overall somatic cell count up a little bit. What do you do in herds like that? Or does that matter at all with your strategy? So again, they do a good job with heifers. Overall somatic cell counts probably 200,000 to 300,000. New infections are low, but just these sort of bugger chronic cows, do you just cull them? Do you culture them? It's sort of related, but sort of not related.
It is related, because I think it's part of our sort of overall mastitis risk picture, right? So, our traditional thinking is that we called Myco, Staph aureus, Strep ag, and now Prototheca are contagious pathogens. And when we say contagious, we mean that they get transferred from an infected cow to an uninfected cow via milk, right? So we get milk contamination from one cow to the other. That's contagious transfer. We now know that a lot of our, or at least a handful of our environmental pathogens, like some of our environmental streps, Strep uveris, Lactococcus, Klebsiella, can also be transferred from an infected cow to an uninfected cow in the same way, through milk, right? So I think our definition of contagious is not quite as black and white as we would like it to be. And so when we have cows that are chronically infected, that means that for some significant percentage of the time, they are shedding those organisms in their milk, which is a risk for other cows in your herd getting infected with those pathogens. So they're now not just getting exposed to environmental pathogens in the environment, they're getting exposed to it during milking time, on contaminated equipment, on milkers' hands, in more of a contagious transmission route. So I think that's one reason is we want to cut down on the contagious transmission of both contagious and environmental pathogens. So to do that, we need to get rid of some of these chronically infected cows that are shedding organisms in high numbers. The other thing is, these cows are just, like you said, they're kind of dragging down our milk quality picture overall. Most of the cows that are chronically infected are not going to cure over the dry period. They're going to maintain those infections in the next lactation and continue to have high somatic cell counts and recurrent clinical mastitis, and again, be a risk to other cows in your herd. So I think making a timely decision about some of these chronic infections is really important, both just for your overall sort of mastitis and milk quality picture, but also if you want to have a good, successful selective dry cow therapy program, it's probably a good time to evaluate some of those cows.
We're talking about evaluating some culling decisions. You'd mentioned that heifers who had been treated, especially for some respiratory issues, they can carry the potential for infection once they're freshened. How do we determine a cull list before we even jeopardize our milking herd?
That's an interesting question. And unfortunately, there's really no way to do that, right? We don't know which of those cows are going to be spreading. And that is a specific scenario with mycoplasma, because we know mycoplasma is a common respiratory pathogen in young stock. Luckily, it's a relatively uncommon mastitis pathogen in adult cattle. But again, the traditional thinking was you can't get mycoplasma unless you purchase infected cows. And that is just not true. We have mycoplasma outbreaks in closed herds. And one of the ways we think that happens is that we have cows that become persistent carriers as young stock. They freshen in for the first time. They might not even show any clinical signs, Fred. Unfortunately, they're not going to give you any sign that she's, typhoid Mary in the herd, and you're going to all of a sudden develop a mycoplasma outbreak. So it goes back to the screening strategy. There's unfortunately no way we can test those cows, or no practically feasible way to test those cows before they enter the milking herd. So monitoring our herd for contagious pathogens is the way we sort of tackle that early before it gets out of hand, through bulk milk screening and or culturing our fresh cows when they freshen.
I'd like to remind everybody, if they have questions, to just go ahead and unmute and ask their questions. In addition, I've re-entered the evaluation link. If you will please click on that. It's very short, but it's very valuable for us. Jim, do you have any other questions?
Yeah, you do a lot of troubleshooting on farms, Darren, because I get a chance to work with you, fortunately. So when something goes wrong, what most likely goes wrong? So this is sort of, as people are thinking about implementing this, what is kind of the biggest thing you see when this kind of blows up in people's face? What should they be wary of?
Yeah, again, it's dry off procedures. It's probably the number one thing. Okay. Is that we might think that we're doing a good job with our dry off procedures, but if we're putting antibiotics in every quarter of every cow, we might be covering up some of our problems, because we're going ahead and treating anything that we might be introducing at the same time. If we make the switch to where there's a large percentage of cows that aren't getting antibiotics, but they are getting a teat sealant, again, that's a higher risk proposition. It's a more important than ever to have excellent hygiene practices. So I would say the important thing is having a fresh set of eyes come in and evaluating your dry off procedures. Because if you're the person on the farm that's doing them, or you're the person on the farm that's managing the people who are doing the dry off procedures, and you've been looking at them doing it the same way for years on end, I mean, this happens to all of us. Like, we're not good at seeing what's right in front of our face. Like the abnormal becomes normal. So having a fresh set of eyes, an extension agent, your veterinarian, some other, trusted advisor who can come in and just do an audit of your dry off procedures. Just stand in the parlor and watch dry off procedures. Look for any practices that aren't perfect. Do a training, get a new protocol in place, and just really fine tune those dry off procedures to make sure that we're using excellent hygiene and following the protocols.
I've got kind of a follow-up question, just as we were thinking about, as been analyzing I analyze a lot of DHA records on a regular basis, and typically I'll get calls about this time of year. My somatic cell count has gone up. Can you look at my records? And at first place I look is fresh cow and heifer infections, because they're in the mud, mud and dirty lots. It's just really hard. And so does that need to be taken into account? Has any of the research looked at what kind of lots these animals went into, what kind of housing they went into? And, or if I'm going to do this, and I know this complicates it, Aaron, but should you do this seasonally and say, I don't know, although these are animals that are fresh now, so they've been through a dry period, but can you talk a little bit about the environment that these dry cows might be going into, and the seasonality of what that might look like? Does that matter?
I mean, it has to, Jim, right? I mean, do we have any research on this? No. But from a practical perspective, like, you just said there's seasonal influences, right? So that, again, I think there's a lot of leeway here. This is not a one size fits all program. If you start doing it today, you don't have to do it the same way for the rest of your life. Maybe, I think in a perfect world, we would work on our facilities and environment, reduce the risk, because that's going to have a lot of other positive benefits, right? If we don't create those infections in the first place, that would be preferable, right? So try to do that. But if for, various practical reasons, we know that we have an uptick in heifer mastitis in the spring because of our facilities, maybe that's not the time, to start selective dry cow therapy, right? I mean, we're not talking about springers here practicing selective dry cow therapy because they're not getting any dry cow therapy on most farms. But if there is some population of cows or some seasonal effect, you can modify the program in a way that makes the most sense for the risks for your dairy.
Here's a really good, you want to read the question in the
Go
chat?
ahead,
That's a good
Jim.
question.
That
Can you see
is.
it?
Yep.
Drying up some cows, 50 liters. So for people that are in the US, that's about 100 pounds a day.
Oof.
And there's some products on the market. I assume he's talking about like Bovacalc Dry that have been out. I know actually Minnesota is doing some research on that. Do you have any opinions, thoughts? Obviously that might help, but just your thoughts on these dry off products along with these high producing cows.
Yeah, to be honest, I don't know a lot about them. I know that some of the Bovacalc Dry research is pretty promising, but I don't know about a lot about it. And I don't know anything about any other products that you might be referring to. Do you know, Jim?
No, that's the only one I'm familiar with. And I don't know how well that's worked in some of the trials that have been out there. I've seen some preliminary data and
yeah, basically all I know, is that the preliminary data looks promising, and that's all I know about it at this point.
Very good. I don't see any other questions in the chat. I've got one. I'm seeing a lot of cattle selling, a lot of people buying cows. When I ask, I always say a quarantine is almost essential. But for new cows coming in, give me a protocol. Do we bring them in, put them in the quarantine stalls and immediately test everything? Or what kind of protocol do you suggest?
Yeah, okay. So on the spectrum, there's ideal and then there's practical, right?
Yep.
So every farm's got to find where you fit on that spectrum. The ideal is getting bulk tank diagnostics from the source herd, culturing each individual animal, or sampling and either culturing or PCR testing each individual animal for contagious pathogens would be ideal, and quarantining them and milking them last before you introduce them to the milking herd. Yeah, those would be great. On many, if not most farms, they don't have a quarantine pen. It's not logistically practical to quarantine them and milk them separately from the rest of the herd. So you're going to introduce those cows to the herd, still collect a sample and culture it. And then that way you have a limited time frame where they're posing a risk to the other herds. And then the other thing is, if at all possible, don't move those cows around a lot until you get your results back. Maybe they just go into one pen and they stay in that pen until you get the results back. And then that way, if the worst scenario happens and you just bought a mycoplasma cow, what cows they were exposed to, and you can kind of limit the infection early on. Again, I think just regular bulk tank screening, if you're doing regular monthly bulk tank cultures, again, you're going to pick up the introduction of new contagious pathogens quicker than if you're not, and you're just doing culturing in response to a problem that you already have.
So Aaron, along that line, you really emphasize that, and I agree with that. But like with myco and prototheca, you kind of need a special, that you just don't pick that up with a regular bulk tank culture. How often would you request prototheca and myco screening? Would you do that on a monthly basis with your regular cultures, or would you do that? Okay, so you just do really the whole gamut on ideally a monthly basis or a regular basis.
Yeah, so in our lab, prototheca and mycoplasma are automatically included in bulk tank culture unless you tell us not to do them. And if you check that don't include them box, it only saves you a couple bucks. So yes, just as a routine thing, culture your bulk tank for everything. If you're not using our lab, check with your lab and make sure that they are including prototheca and mycoplasma on your bulk tank cultures, either routinely or by request, because labs vary. Every lab has a slightly different protocol for what they routinely report. on bulk tank culture. So check with your lab. But yeah, I mean, again, it's relatively low cost here, and it's like a great insurance policy. Yeah. And so so you can just routinely detect prototheca on bulk tanks, no problem.
Okay, we've got a question here that you really did an in-depth answer to. The person came in a little bit late. Can you maybe give a one or two
Sure.
sentence idea on when you recommend culturing
Yeah.
for dry cow?
Yeah, so I think we talked about this a little bit, and as we just discussed earlier, everyone will have access to the slides and the whole webinar recording, so you can kind of catch up. But yes, culturing is an effective way to practice selective dry cow therapy. It's going to be less economically advantageous compared to algorithm guided dry cow therapy, where we're just using data that we already have, basically without any additional cost of culture plates, the labor associated with collecting a sample, culturing them, reading the results. But it is a nice way to have an actual diagnosis of intramammary infection status at the time of dry off. And I think there are honestly quite a few products on the market that can be used. If our goal is just to detect infection, we can use really simple culturing tubes that are, culturing plates that are like, growth, no growth. If there's growth, treat it with antibiotics. If there's no growth, internal teat sealant alone is adequate. So I don't think we have to get fancy. We can keep the cost like relatively low and use simple culturing tools that are widely available. Yeah, that's my quick summary.
Very good. I don't see any questions in the queue. We'd like to thank you again, Dr. Royster, for the presentation. A lot of great information here. If you'd like to listen to it again, I've included the archive there at moouniversity.com. Please click on the evaluation link and tell us or answer the 4 questions. It'll help us out as we move on to new ones. Again, thank you for attending, and I will be closing the Zoom at this time.
Thanks, Aaron. Have a nice day.
You too.